Hi, everybody. Welcome to today's episode of the Dr. Keith Darrow podcast. I am honored to welcome to today's show Madison Levine, who is, I think many of you know, she's a board-certified hearing instrument specialist and, dare I say, social media pop star. Have you put that in your resume yet, Madison?
Oh my gosh, not in those words, no.
Influencer. So what words are you using?
Oh gosh, I don't know. I like the word creator.
All right, fair.
Yeah.
Content creator.
It's so much fun to create. Yeah.
So that's actually, I mean, you just segued right into my first question, which is really, there are some, it's different today than it was 5 years ago, but there's still some stigmas in our industry about the use of social media when it comes to trying to educate patients. And I think the biggest stigma or the biggest pushback would be my 70-year-old patients are not on social media, which you and I know is rubbish. Look, I thought it 5 or 6 years ago until my business partner showed me a patient, an 82-year-old woman who opted in to receive a copy of my book at 2 a.m. So I'm like, that's it. I'm convinced. But what is that like, sort of creating that content and getting it out there? I got to know that story.
Yeah. Well, gosh, you're so right. I mean, I've got lots of patients, my own patients who are following me on social media, and it's been such a great educational tool for me. Rather than just harping on stuff in the office, they at their own pace can go and consume what they want to at the time. But what I have found on social is I'm not just talking to that patient base. I'm also really aiming to speak to their children, like who is helping get them into that appointment, who's talking to them about the issues they're seeing at home. So some of my content is geared towards the patients and more is geared towards their kids, actually.
So you're talking about engaging with not only the patient, who let's just assume we're talking, 55 to 75, but we're also talking about the adult child. We're also talking about the grandkids.
Yes.
Right.
Oh, yeah.
And reaching out to them. And what sort of a response have you had to that? Because we've done some work successfully with reaching out to the loved ones, be it writing white papers or including that point of view in our books. So how has that been on social media and the response?
Well, it's been really good. I mean, it's actually gotten people in the door. And I see on a lot of these in seminars and things that I go to where we talk about marketing, there's an assumption that social media is only going to be awareness based and that you're not going to get anybody in the door because of it. And I just have not found that to be true. I think it depends on your messaging and on your consistency. So, posting for a month and not seeing any traction, I can see why a lot of people give up. But it's a slow build. You've got to create trust with people. And it takes a lot of times of them seeing you before they remember you and they trust you.
Well, I mean, so we're very, not me, my business partner, so I will not lay claim to it, but my business partner, who's a marketing genius and a numbers, guru. I mean, we've got the paperwork, we have the spreadsheets to show you over the last 5 years of 15 to 20 to 1 ROI on social media marketing. So it's awareness if you don't have the right message. It is a massive tool for revenue generation if used the right way.
Yeah, absolutely. I completely agree with that. And I think the hardest part for me, and I think for anybody who's a creator, is actually coming up with the content. And I mean, the first few messages are obvious. You know what you're going to say and what you want to communicate. And then you start kind of running out of things and trying to think, okay, how can I repackage this in another way? But the repackaging is what's so important because everybody's not going to receive the same message in the same way.
And everybody needs to see it 7 to 12 times. So
yes.
So let's actually dive into that because I would like to learn a little bit. I do content creation. And so I would love to sort of what's in your head, because look, there are other people in our industry, and I'll give a nod to Dr. Ben Thompson, who talks everything about tinnitus. Somehow that guy has figured out how to take tinnitus and splice it up 12,000 ways and to make
Yeah.
12,000 posts out of it. And that's not easy. So what is your creative process?
Yeah. Well, I do a lot of batching. So, creating a lot of content in one day so
Okay.
that you can then use it over time. I think it's really hard to jump in and out of a workday and think of a message one day and the next day and the next and get all of that also out there. So I do a lot of sitting down and writing out my ideas one by one, and then just creating all of those videos in the same day. It can't hurt to, change jackets in between or put your hair up or something so people don't know that it was all at
Right.
once.
Of course. Fair enough. I have to tell you, you make me feel 1,000 times better because I've done that, right? I've set up my home studio, changed my tie, changed my shirt, changed my jacket. You can interchange them and you can get at least 12 different outfits out of it.
Yeah. Exactly.
And I'm like, is this content creation or is this, but, and I think you would agree, and I'm sure you do it also. You do, dare I say, liven it up, and you do throw in that like, hey, I just had a whole bunch of caffeine. I got this great idea and I'm just going to shoot it and post it. So I'm sure it's a mix of the two.
Oh yeah, absolutely. There's a combination for sure. But I'm learning just like everybody else. So I don't claim to have the magic formula. I have noticed, different mediums, you're going to get more traction on different types of content. And so that's been kind of a test to see, the content I'm putting on Instagram is not necessarily what I'm putting on LinkedIn.
Okay.
Or on TikTok. TikTok was new to me like 4 or 5 months ago. I had never been on the platform before. So jumping in and figuring that out took a little bit of time, but I'm starting to see the traction. So sometimes it's just practice to see what sticks.
So let's talk about that. Let's sort of, if you don't mind, I guess, pulling back the curtain as to what is the mindset when going on to TikTok versus Instagram versus LinkedIn, because this is something that I certainly have not honed that skill yet. And I'd love to learn more. And I think other people who really, they want to help and they want to educate more of the 42 million, but they don't even know where to start. And that is such a block. So I think this will be really helpful for those people.
Yeah. Well, we talked about the age demographics of, what age people are on social media, but it's spliced even more by platform, right? So we know that Facebook started as the young people's social media. And then as their parents and grandparents started getting on, the younger people started flocking away from it because they wanted to share their private whatever where their parents couldn't see it. So they flocked to Instagram, and then you've got TikTok. And so I kind of look at it in those layers of age groups. So Facebook is going to be my oldest demographic, and TikTok is probably going to be my youngest. So that's who am I messaging in those platforms?
Sure. And give me an example of, let's pick a topic. Let's go with cognition and hearing health, which I want to talk about deeper later. But right now, let's just that topic. How do you take that and Facebook it, Insta it, and TikTok it? How would you take that?
Oh gosh. So it's who you're speaking to. So if you're on Facebook, you're saying, untreated hearing loss may increase your risk of cognitive decline by 30 to 40%. And you're saying your risk.
Okay.
Whereas on Instagram, I might be saying, have you talked to your parents about the risk of cognitive decline? Are you noticing that they're turning up the TV and they're asking you what you said over and over? And then TikTok, it's going to all be imagery. You're pretty much going to be making a funny video. Do you have to
dance it and sing it and like shoot off confetti?
Basically. And you're just like, it's like the Wild West. It's, you have to be able to laugh at yourself and be pretty self-deprecating.
Sure. Like I could just, I'm just, somehow, I guess, not only making fun of yourself, but making fun of, your grandparents, like, huh? What? Yeah. Okay.
Exactly.
I get it.
So same message, 3 different ways. Yeah.
Sure. So, and that is where I guess the content creation really, I mean, I'm still not sure how you own a clinic, right? You're a provider, you have a whole team behind you, and you're really a content creator, but you're also an influencer, right? You really are influencing the way people are thinking about hearing healthcare from 12-year-olds up through, 80-year-olds. And so I'm not sure how you do all 4 full-time jobs. And you're a mother, right?
Yeah.
Most important job of all. So how do you do that?
Yeah, with 2 toddlers. Well, if they're watching Paw Patrol, I've got one hand free for texting. So
There you
I
go.
can be posting an Instagram video while Paw Patrol is on. So there's a lot of that kind of multitasking happening. But I do have a really great team at my office that has freed me up some to be able to do more business management. I think a lot of providers, a lot of the time, they love what they do clinically and they hate the business management. And if they could just hire that position, they would be much happier.
Sure.
I love clinic, but I love business management. And both my parents own their own businesses, so I kind of grew up in that. So I think in that way, I'm just lucky that I enjoy both sides. But I say, if you don't like one or the other, then hire that part out.
Yes.
I mean, you don't have to wear all the hats. Wear the hats you enjoy, and you'll be good at those.
Yeah, in our coaching group, we have such it's a mixed bag of all these different clinics and owners. And you're right. There are some owners who, after 20 years, say, I have to be done seeing patients if I want real growth. And so hire a provider, set up the systems and processes so that provider can be successful and so that you can work on the business. But I've also seen owners who say, no, seeing patients is my love. I was crazy enough when I was younger to say, hey, let's start a business. But now that part is the one that's wearing on me. So you really do have to make a decision, I think, on which one, or this one's probably the toughest, is hybrid, right? Which it sounds like you're doing. So are you in the clinic a few days or?
Yeah. So I'm in clinic 4 days a week. So Wednesdays are my administrative day, which is really nice. It breaks up the week really well for me. But I do jump in and out of the social media part morning, afternoon, and evening. And that for some reason doesn't seem to shake me up too much as long as it's just deploying. So I may have already created the content ahead and it's just deployment.
Gotcha. So you have your creative days, you've got it all lined up, and then just hitting the post button, right? For lack of better term. Gotcha. So that's because it would definitely seem, I mean, it is genuine. Everything you're saying and doing is genuine, but it would definitely, I think a lot of people are scared of that commitment. But if you schedule it out and you plan appropriately, right? I mean, I would say 30% of my social media posts are just off the top of my head. I'm going to do it live, right? Yeah. But then the rest of it really is planned out, and it's planned with an intention, which is to build the following, to educate not only more patients, but I do a lot of messaging to our field, which is how to really become the best hearing healthcare provider you can be. And here's all the new and great things, whether it be CEU events, neuroscience boot camps, so on and so forth. So
yeah, your mix is so good. And that's how people get to know you on all different levels. Those lives are so genuine. And then you've got this educational content where that's why people keep coming back. That's why they click follow on the profile. They want to learn from you, and then they want to get to know you in the live. So it's like they're getting the best of both worlds.
And I think you hit a key point there, which is, and what was that like for you? Because it's not easy for me. It continues to not be easy for me. If you ask me something, I'm an open book, but I'm not one to just put it out there, right? Mm-hmm. So was that a struggle for you, or is that something that you just, it came naturally?
No, it's a struggle. I think it just depends on the day of the week. But even now, I mean, if I go look at one of these profiles, I feel like, oh my gosh, I look so egotistical. Like it looks so much like, look at me and look at what I'm doing. And I hate that feeling. But at the same time, I see this community growing and people are sending me messages about how it's helping them. And so I push that down and just keep doing it. But
and just hard. Keep going. Yeah. Yeah. I stay away from the comments, and I really don't look back at my own posts.
Yeah, I shouldn't.
I find that to be the most helpful.
Yeah, that's good advice.
Well, I think, look, even negative comments, positive comments. I mean, it just shows that people are listening. And I think it's good. I think we're at a point now, and I'm sure you'd agree, in hearing healthcare, where we really have this flexing point of, are we going to go in this direction? Are we going to go this way? Are we going to do it together? Are we going to do it separate? Right? I mean, there's a lot of questions, a lot of things changing, and the spotlight's on us to really ask us who we are, what we're all about, and what our value is, which brings me to my next question, which is, you are a board certified, right, hearing instrument specialist.
Yes.
And I believe in the services and the value you provide wholeheartedly. I said this to you offline. There's 42 million people to help. We're only going to do this if we do it together. What is your viewpoint on the board certified hearing instrument specialist, audiologist, doctor of audiology? I mean, how do you look at these things, and what are your thoughts?
Yeah, I think we're approaching things from different perspectives. We each have our own education that has given us a way of looking at the problems and looking at ways to solve them. There are some things that I think we are both very well suited to help people with. And then I think it's very important to know what's within your scope and what is not. So, I have seen, as probably everyone has, HISs who stretch their scope to make it seem that they are, a white coat or whatever.
Sure.
And I'm not saying that, that's all bad. It's just, I'm proud of the letters after my name, and I don't wish for other letters. BCHIS is exactly what I should have done with my life. And I'm able to help thousands of people every year to hear better. I also employ some audiologists who have a much broader scope than I do. And I have immense respect for the schooling that they went through, and the ways that they're able to help our patients in areas that I am not able to. So I just think that there's not enough of us.
There is not enough of us.
You said 20,000. I mean, I've looked at some different numbers through the years, somewhere around 13,000 audiologists, 8,000 HISs, something like that.
Yeah, we're in the same ballpark. There's about 20,000 of us, give or take. I don't know, pre-COVID numbers, post-COVID numbers, who knows? But the point is, if 10% of people who need our help woke up tomorrow and said, yeah, I think it's time for me to go get some treatment for my hearing loss, we would all have a 12-month waiting list.
Yes.
It's just,
Absolutely.
It's not possible.
Yeah. There's too many people to help. And so, we've got a lot of history between the two professions that we don't have to go in depth into. I think a lot of us know there's been some competition. But what I would rather see is a push for both to elevate, and let's just strengthen our ethics and our morals for how we're taking care of people, how well we're trained. There's no need to tear down a profession or say that they're not doing as good a job. Let's just keep empowering each other, because there's too many people. We have to help them all. So, that's my take.
I'm trying to come up with a catchphrase for maybe someday you and we co-host a conference, and it's stop the competition, begin the collaboration.
Yeah, I love that.
Right. Wow. Something where, and again, and I said this to you earlier, but it was before we started recording, which was, look, I would not expect you to be doing intraoperative monitoring during a cochlear implant surgery. And guess what? I don't have enough training, and it's been a while. I was in the OR doing some ABI, auditory brainstem implant procedures, but it's been a while. And so right now I wouldn't feel comfortable doing it. It would not be to my patient's benefit. And so there are people who specialize in things, and let them do that. But if we're talking, 90% of people with hearing loss have the vanilla presbycusis and have difficulty comprehending speech and have difficulty hearing their grandkids, and they're at increased risk of cognitive decline. Like, yeah, we can all do that. And there should be 10x more of us.
Yeah. Yeah, absolutely. I mean, we should be attracting people to both professions for the range of each of those scopes, depending on what you want to do. I mean, you see plenty of audiologists that choose to just go into dispensing.
Mhm.
That's what they enjoy and that's what they want to do. I don't fault them at all for that. That was a lot of education to get to that point. And I don't wish to be taking care of pediatrics. That's not something that it was for me.
Me either. Love my kids, but
I'm not
no.
doing balance disorders. Yeah. But, those are things that we are going to be doing in our clinic because I've got people that is within their scope.
Curious, if you don't mind me asking, like, how did you handle that? Right. I work with a number of BCHIS who own a private practice. Their morals, their values, and the continuing education that they have sought is equivalent to the best damn audiologist out there. Mm-hmm. Have you come across any issues with that, or how have you handled that? Okay, we have different letters after our names, but let's work together. Tell me about that.
Yeah. Well, I'll say I'm probably a little new to it to have enough experience in any negative interactions. So far, everything's been just really easy. I think it depends on the person. The first audiologist I hired was really just interested in dispensing. And we both were really comfortable supporting each other and basically performing the exact same role in the clinic. So when a patient called, they could equally get one of us and get the same level of care, right? As we move forward, I have another audiologist coming on board in May. And we have an audiology resident as well in her fourth year. So I've never done that before. So it'll be a little bit different because I'm not going to be the one directly supervising, right? That resident is going to have a preceptor that is not me. So we'll see what it feels like going into the next stage. But I just think in lots of businesses, you hire people who are better than you at certain things and are more skilled than you. And how you lead and how you set the tone for the culture, that's up to you, but you don't have to tell them how to do their job if they're more skilled than you in that area.
Sure. Now, allow me to play devil's advocate for 30 seconds.
Yeah.
Perhaps you've upset some HIS with your hiring practices recently. Have you got any kickback or are you anticipating any? And I mean, frankly, you had an option to hire a BCHIS or audiologist. You seem to have gone in one direction. Yeah. What's that about?
It's worked out that way. I'll say, the way that I'm expanding my clinic, we're working into a more medical type of practice. We're adding balance. We're adding an entire balance clinic opening in June.
Excellent.
And I'm very excited about it. So we're going in a more medical direction. I think everybody, like you already spoke to earlier, everybody is looking at what's happening in the industry and they're deciding what moves they're going to make and what role we're going to fill. I am looking at continuing, of course, the work of treating hearing loss with hearing aids, but we're also moving heavily into other areas. So whether it's balance, tinnitus, APD, my goal is to have a clinic that can treat a wide variety of things where people can come to us. And I just want to be the best in our region for everything, not just, a retail hearing aid clinic.
Sure.
In my view, I think that as things change with OTC, DTC, I think that retail, just storefront hearing aid clinics that are just churning people, I think they're going to have a very hard time presenting where their value lies. So that's why I'm going in that direction. But I think that's great. I think that there's so much room there. You're right, because if we all face the fact, which is the widget can be purchased anywhere, and at some point very soon, the exact same widget that we hand to a patient, if we just assume that, the exact same widget we can hand to a patient, they can get anywhere else. So then what is our value? What is the purpose
that we serve. And I believe not only expanding into balance. So I know for us, as part of our Excellence in Audiology Network, we have a tinnitus certification. I'm the only trainer in hearing healthcare for certified dementia practitioners. And I'd love to work with you and your team more on that, because that medical model, it's not just real. It's not just a business move. Hearing healthcare is, it is healthcare. It is preventative medicine. It is cognitive health. So to ignore that is, I think, just foolish. And that's why I was saying we have this option to take the high road and serve our patients to the best of our ability, or just keep selling widgets.
Yeah, that's exactly how I feel. And I saw that momentum in my own practice. I started it 7 years ago, and I came from a retail setting. And my mother had a hearing aid clinic when I was growing up.
Okay.
And so she was there when there was this split with HIS as an audiologist, and she was just the retail clinic. That's what she was. She mentored me immensely on things that people don't even do nowadays, with all kinds of cool stuff. The way that she would modify ear molds, and she got carpal tunnel from modifying ear molds.
Wow.
I don't know how many you're making them perfectly, right?
Yeah.
We don't see that many of those in the office.
Right. Of course. Yeah. That's a lost art.
It is. But immediately I started feeling like we needed to do more. And I wanted to be screening more carefully, referring more freely to ear, nose, and throat doctors. My state licensure has certain rules for when I should be referring. I think they should be stricter than they are. And so, that's something that we implemented early on. But as we see now the whole industry moving in this more medical way, I'm just so happy for the patient, because we know how their total health is affected by this foundational sense of hearing. I think in healthcare in general, we see this chopped up type of care where you don't have one person in your care team who's looking at the whole picture. You're getting this medication from this guy and PT over here, and none of it is being brought together. And I think we have a real opportunity to be a central piece and to communicate well and send fantastic reports to each one of those care providers that person is working with.
I think that's such a valuable take-home message for anybody in hearing healthcare, that, right, number one sensory disorder on the planet, yet one of the least treated medical conditions. So how do we change that, right? Because it's our job. Nobody's going to change it for us, right? If you hand it to corporate America, they're going to just sell over-the-counter widgets, which I don't blame them, right?
Yeah.
But we have a choice here. And I think that we have this opportunity to really help people know that hearing loss impacts emotional, social, physical, cognitive health. And there's no ifs, ands, or buts about it. And we all have to band together with this messaging. And I think that medical model, and I'm sure you're seeing it too, now it's the cool catchphrase and everybody's using it. But unfortunately, and I think that maybe the weak won't survive, or whatever that expression is, right? When you pull back the curtain, there might be marketing for a medical model, but when you break trust and a patient comes in and the conversation is instantly about the sale of a hearing aid, that's not going to work.
No, not
you
at
have
all.
to be able to provide real value, which brings me to one of the things I wanted to talk to you about is, what have you seen and where do you see us in the next, say, 5-10 years when it comes to cognitive health? Because right now there is this issue of cognitive health, AUD versus HIS.
Yeah. Well, I can't say that I know what's going to happen between the two professions. I think that'll end up with licensure issues. Like, we'll figure out somebody's going to figure that out. But I think in both clinics, we should be able to screen for cognitive issues. We are oftentimes seeing people for such a long period of time. They may come in to see us in their 60s and they are a patient until their 80s. And what if they go into a clinic and it's just HISs. They're getting fantastic hearing health care. And we could have the ability to screen for mild cognitive impairment and to refer. It's not about a diagnosis. It's about the risk for having this impairment. Therefore, go get checked. We're seeing
you just raised an amazing point, and it actually, without getting too emotional, you hit home such an important message, because I think about my grandmother who died with dementia. Mm-hmm. The thought that, right, if she were alive right now, and if she were with you, if she were with this amazing HIS, now I know you have audiologists, so it's a little different, but if she were with you under your care for 15 to 20 years and you saw something happening, you could see the changes happening, because most primary care physicians do not talk about cognitive health. Yeah. But if you had that opportunity to screen my grandmother and perhaps have caught her early on in the process, and maybe that mild cognitive impairment did not have to become dementia. We know that it can be prevented in a significant number of cases. That right there is no argument against that. No argument that I'm willing to listen to. If you have the right education, the right certification, if you know how to do it, then you should be doing it. And I just, right, that is such an important thing that we are seeing. HIS are seeing so many people who are at risk. Why can't we screen it?
We are. Their primary care physician gets 8 minutes with them, right? And we get, 20 minutes to an hour and a half with them, depending on the appointment. We have longer appointment times. We have really strong relationships. When somebody gets a hearing aid, they're going to be in the clinic at least every 6 months for the rest of their lives. Right. And I'm not to scare off people that don't have hearing aids yet, because that can sound like a lot, but that really is what happens. We know when their dog died, we send them a card and flowers when their spouse passes. We, help them in the door when they've had their next knee replacement. Like, we're there through so many pieces of their lives and care. And we start to see when they become a little forgetful, when they start plugging in the hearing aids wrong, they start putting the wax guard on the wrong side, they put it in the mic instead of the receiver. We see these things. What is our responsibility, and how do we reach out? Should we be just sending a note to their primary care physician?
What would that note say? Worried?
Yeah. What would it say? It seems like there needs to be some system, a way of screening for even the mild, so that it gets caught sooner. Yeah, we're uniquely.
So what have you been doing?
And
because there's a lot of options out there. We started with paper-based tests. We've now moved to computerized testing. What are you doing in your practice for your patients when it comes to screening, not diagnosing, comes to screening cognitive health?
Well, not enough. That's going to be our next phase. That's what we're moving into. But right now, I think reporting, having that relationship with the primary care doctor and owning it, not just saying, okay, we got a referral. We're only communicating with the patient. I think HISs really need to step into their role as a healthcare provider and start communicating better with the other care providers on that patient's team. I think audiologists do a much better job of that. I think they have, sometimes they have a little more confidence in being a peer with those other providers. And HISs need to do the same so that we have open communication.
I maybe I'm a pessimist, but I'm not sure I'm convinced that there really is much of a difference. Look, there's so much room for improvement on both the audiology side and the HIS side. And I think it starts with the patient's best interest in mind, right? Right now, I'm talking 10 years after it was included into the scope of practice, there's still only 15% of practices, audiology-based practices, that are doing speech and noise testing.
Mm-hmm.
Meanwhile, it's the number one complaint of every patient. Meanwhile, speech and noise scores are linked to risk of cognitive decline, yet only 15% are doing it. I think when it comes to cognitive screenings, we're only at about 2 to 3% of practices have the ability. Of the practices that have it, I still think we're only at 50% of those practices even doing it on a regular basis. Real ear measurements are done less than 40% of the time. I mean, there's so much more we can do. And this has been in our scope of practice for such a long time. Yet I feel like we're just bogged down in these arguments of letters after names and the patient's losing.
Yeah, they are. It's not fair. We do speech, noise, and real ear measurements routinely, really, or on everybody. Obviously, I don't understand how you cannot. But going into the next phase of cognitive screenings, I mean, we could be doing better with our paper questionnaires. We certainly could do that. I'm really curious about what's going to happen with CogniView. What they're going to do next. I mean, it looks like they're making a huge push. They hired a boatload of audiologists to go into hearing because they see what I just said. PCPs have 8 minutes. We have 75. So they think, let's just plug it in right here. I have a tough time seeing where to plug it in and make sure it's financially viable in the clinic. So, I'm going to talk to other clinics that are doing it successfully to better understand what have they done. And that's where I think all of us can look for mentorship in each other and keep building each other up.
Well, I can definitely tell you that there are, 4 major value propositions when it comes to cognitive screening. And we're going to be actually hosting a big event on this, right? Like we know that doing cognitive screen, you talk about the financial viability, right? We're talking about establishing greater relationships with referring physicians. So it'll pay for itself 10 times over if you stop right there. We know that when your patients are regularly being screened, we know that it's a part of their critical long-term care and that it actually helps your patients to understand the need for upgrading their prescription every 3 to 4 years to help maintain, if not improve, their cognitive health. We also, how many times nowadays are we seeing, even though I hate the term, hidden hearing loss, right? We're seeing these early stage hearing loss and patients are like, I don't know. It's early on. Parts of my hearing test show normal hearing. Why should I bother starting treatment today? Well, because your cognitive health is at risk, right? And then for those, look, bundled or unbundled, if you're unbundled, you could just charge for it and literally make back your money, super easy. So there are so many ways that cognitive screenings from a business standpoint make sense. Put that aside, I would still pay the $400 a month or whatever it costs for the unit because it's the right thing to do for the patient. Does that make sense? Yeah,
it does. Yeah.
So I just think that that's a great direction. Have you done a lot? I want to circle back. What has the response been talking about cognitive health on social media? I'm just curious because I get great remarks. I get some, why are you talking about this? You're an audiologist. Like, what's that like for you?
Yeah. Well, okay. I'll tell you an interaction I had in the last couple of weeks when I posted about it. We know that there is a difference in the deaf community, little d, capital D, deaf, right? And there's a fantastic, vibrant community of deaf individuals on Instagram and on TikTok.
Yes.
And it's wonderful to see. And I think it's raising awareness and opening doors for better access. You're seeing Instagram and TikTok do a better job of allowing captions and different videos and making it easy, which is wonderful. But I think when we talk about cognitive decline, adding a caveat, who we're talking about, I've just found I've attracted a great audience of people who have profound hearing loss, and they may or may not be wearing hearing aids. And when I write about cognitive decline, they are a little mad about it until I add the caveat of like, who are we talking about here? I'm not saying because you're deaf from birth, you've acquired ASL and you're stimulating your brain, you're communicating well, you're not, right? We know that there's different variables for different groups of people. So I know it's not exactly what you're talking about, but I just had that experience where I kind of made an uproar happen.
That is exactly what I'm talking about. I'm exactly getting at the point of, look, when it comes to educating people on social media, yeah, I think you just raised a great point. You have to be careful and you have to be cognizant that you might get yelled at by some people because you might have said something that to you had something in your head, but maybe you didn't verbalize it. And you're right. I gave a symposium a few years back and somebody came up to me afterwards and said, you just said because I have hearing loss that I have a small brain. No. I was talking about the links of cerebral atrophy and hearing loss. That's definitely, I apologize if it was taken that way because that's not what I meant to say, right? Yeah. And you're right that this connection of hearing loss and cognitive decline definitely goes back to people who had the sense and now are losing it, right? As compared to somebody who grew up learning language a different way, their brain's organized differently. I've seen this in the lab, right? I mean, I spent 15 years in the lab studying each and every part of the brain and how the ear connects to it and how they work together. But sometimes we make that mistake of not including the fine print of, I'm not talking about capital D deaf community, right?
Yeah, exactly. I'm not trying to make anybody mad about it. I'm just trying to, in my mind, the people that I see in my office right now are 18 and older. We just see adults. And I talk a lot about age-related hearing loss and noise-induced hearing loss. And so some of the best advice I've seen about your social media posting is don't assume that your audience knows what you know. So you post things without context because to you, it's just another little piece of the puzzle, but they don't have the rest of the puzzle at all.
Yeah.
So a quick video and a quick image, you can be short and concise in your message, but take the opportunity in that caption to explain the background and the color of it so they can be brought up to speed.
That's excellent. I mean, that is such great advice because I know in everybody's heart, when you're in hearing healthcare, right, you grew up wanting to help people. Mm-hmm. Maybe you did it with these letters, you did it with that letters, but at the end of the day, we want to help people. And the only way we're going to do it is together, number one. And number two is by directly educating our patients. And I think you have really honed a skill that has been missing. And that's why I said it earlier, you're that social media pop star that is really helping to advance hearing healthcare. And so I thank you, right, on behalf of the 42 million, on behalf of my patients, on behalf of my grandmother who passed away with her profound hearing loss and died with dementia. I appreciate all that you've been doing, Madison. And I hope that, this relationship continues and we get to do more work together.
Thank you. Me too. Thank you so much for having me. I really enjoyed where these conversations went today.
Yeah, no, it's been great. And look, we've got an upcoming neuroscience boot camp. I'll talk to you more offline. I think that you would be a great addition to something like that. I think that the more we bring our voice together, the more people we can help. And I just, again, I'm honored to have had this conversation. Thank you for all that you do and have a great day.
Thank you. I appreciate it, Keith. You too.
Hey, well, wait, I almost forgot. I always promise myself I'm going to ask one personal question that has nothing to do with hearing. So Let's go with favorite movie.
Favorite movie. Well, my name came from the movie Splash. Would you have thought of that? 1986.
Like you're talking the mermaid one?
Yeah, the mermaid.
Okay.
Yeah. My parents saw the movie and they were like, oh, Madison, what a great name.
There you go. Therefore, it must be your default best movie of all time.
That's it. Yeah.
What a cool fact that now everybody knows about you, whether you like it or not.
Yeah.
Madison, thank you so much. Take care.
Thank you. You too. All right. Bye.